Morning or night can feel like the biggest decision when you use Ozempic, Semaglutide, or Mounjaro, Tirzepatide, but the label already gives the first answer. Either can be used at any time of day. The better answer is personal. Choose a weekly time you can repeat, with fewer side effects, a clearer routine, and less schedule chaos. That is the real weekly target. That surprises people because the shot feels like it should have a perfect clock. A morning dose sounds disciplined. A night dose sounds easier to sleep through. But once weekly medicines do not behave like a breakfast pill that must match one meal. The real problem is a schedule that looks perfect on paper but fails in real life. Friday night may collide with restaurant food. Monday morning may collide with work stress. A good dosing time should make the week simpler, not more fragile. Use this as general education, not a personal dosing instruction for your own weekly plan, side effects, diabetes medicines, or travel schedule. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These medicines slow how fast your stomach empties. That means food may stay in your stomach longer. This can reduce appetite and help blood sugar. It can also contribute to nausea, fullness, reflux, burping, or constipation in some people. That stomach effect is not controlled by sunrise or bedtime. It is a weekly pattern in the body. So the clock time often matters less than meals, sleep position, work demands, hydration, and the day after the injection. The official flexibility is useful, but easy to misunderstand. It does not mean every time feels identical. It means the medicine allows flexibility. Your body may still show a pattern that makes one time easier than another. Morning can work well for people who want to notice side effects while awake. They can sip water, choose smaller meals, and avoid lying flat soon after eating. Morning also helps people who forget tasks at night or fall asleep early. Night can work well when early queasiness is mild and sleep is not disrupted. Sleeping through the first hours may make the experience easier. But night is not ideal for everyone. If reflux wakes you up, bedtime dosing may become a bad fit. Because both options have trade-offs, the better time may be the quietest time. It may be Sunday after breakfast, Tuesday after a shower, or Wednesday after brushing your teeth. The goal is a routine that survives real life. That sounds less scientific, but it may be more reliable. Missed doses often happen because the routine is inconvenient, not because people do not understand the medicine. A stable ritual helps you take the medicine consistently enough for the treatment plan to work. But remembering the dose is only one part. Many timing problems are actually food problems. People blame the hour of the injection, but the trigger may be a large fatty meal, alcohol, fast eating, or late-night snacking. A perfect clock time cannot rescue a rough meal pattern. That is why meal timing matters around dosing. A heavy dinner near the shot can make fullness and nausea more likely. Then the medicine may feel wrong, even though the clock was not the main cause. If Saturday night always feels terrible, look at Saturday night itself. Restaurant meals, bigger portions, richer food, and alcohol often arrive together. Moving the shot may help. Changing the meal around the shot may help even more. Eating gently means smaller, slower, and not greasy. It does not mean starving. Skipping food can backfire, especially for people using diabetes medicines. Many users tolerate the shot better by avoiding a large high-fat meal near dosing time. Meal timing and schedule pressure also matter on workdays. A Monday morning dose may sound organized, but it can make early meetings harder. A Friday evening dose may sound relaxed, but it can collide with social meals. Dose increases can confuse the pattern too. Nausea may rise for a while after a new increase. That does not automatically mean the clock was wrong. It may mean your body is reacting to the recent step up. Now test the schedule against real life, using food, dose changes, and next day duties together. Choose a time you can keep during normal and messy weeks. Ask 3 simple checks. Will I remember it? Can I eat gently around it? Can I handle symptoms the next day? The next day symptom check should include hydration. Dehydration means the body has too little fluid. Vomiting, diarrhea, or poor intake can worsen dizziness. It can also affect kidney stress and whether daily medicines stay down. Use symptoms to choose direction, but keep the logic consistent. If you want to actively manage nausea while awake, morning may fit better. If queasiness is mild and sleep is not disturbed, night before a quiet morning may fit better. If reflux is the main issue, be careful with late dosing and late meals. Reflux means stomach contents move upward and cause burning or sour taste. Lying down soon after a heavy meal can make that worse. If constipation is the main issue, clock time may matter less. Constipation means stools become hard or difficult to pass. Fiber, fluid, movement, and your clinician's overall plan usually matter more than sunrise versus bedtime. Skin symptoms should be separated from stomach symptoms. Abdomen, thigh, or upper arm may be allowed, depending on instructions. Site reactions are local skin reactions, like redness or soreness. They are not the same as nausea from stomach slowing. Rotate sites as instructed, but do not use site rotation to explain every symptom. A red patch near the shot is different from vomiting after dinner. Separating local skin issues from stomach symptoms makes the pattern easier to explain to your clinician. Once the symptom type is clear, write down the dose day, clock time, meals, nausea, vomiting, reflux, constipation, and skin reactions. Add blood sugar if you monitor it. 2 or 3 weeks of notes are often better than one dramatic memory. Blood sugar notes matter for one group. People using insulin or sulfonylurias can have low blood sugar. Sulfonylurias are diabetes pills that push the pancreas to release more insulin. Your clinician may adjust those medicines. For this group, the clock is only one part of the safety picture. The risk depends on meals, monitoring, and the whole diabetes plan. If low readings appear after a routine change, report the pattern clearly instead of guessing. Travel can still disrupt a good routine. Time zones can shift your usual evening dose into a different local day. Do not improvise close dosing to match a flight. Use your prescription instructions and ask before long trips. Schedule decisions should be simple and easy to track. Keep the same weekly day when possible. If you change the day, follow the spacing rule for your exact medication. Do not stack doses close together for calendar convenience. Ozempic and Mounjaro have different day change rules. The exact product matters. Check your prescription instructions and ask your clinician or pharmacist before changing the schedule. This prevents accidental close dosing during travel or schedule changes. Spacing rules help routine scheduling, but urgent symptoms are different. Call your clinician urgently for severe abdominal pain, repeated vomiting, fainting, signs of dehydration, or very low blood sugar. Also call if side effects stop you from eating or drinking. Once urgent symptoms are separated, timing becomes practical again. The safest answer gives consistency, gentler meals, and room to manage symptoms. The best schedule is the one you can repeat when life gets messy. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.